Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about extracellular proteins and connective tissues, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss indicative repertoire, knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to make candidates' portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the second subsection of the second section, demonstration techniques, called extracellular proteins and connective tissue. The portfolio offers indicative repertoire for this subsection that includes Meson trichrome, HVG, Congo red, Sirius red, EVG, reticulin, collagen 4. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. The first knowledge requirement is role of fibrin in tissues and the pathophysiology of fibrin formation. Candidate needs to have the knowledge and understanding about the formation and role of fibrin in tissues. You could ask the candidate to explain, what is fibrin and what role does it play in healthy tissue? Why is fibrin formed in the tissues? What are pathological implications of fibrin formation in tissues? To name demonstration methods that can be used to demonstrate fibrin. When addressing this knowledge requirement, candidates should consider hemostasis, wound healing and mesh formation, stopping bleeding, guiding cell activity and interaction to influence adhesion, proliferation or migration, inflammation, host defense, coagulation cascade, bleeding disorders leading to excessive bleeding, thrombosis due to abnormal fibrin structure formation, inflammation due to altered fibrin structure, cancer progression and metastasis, neurological disorders. The second knowledge requirement is pathophysiology of amyloid formation and the different types of amyloid. Candidate needs to have the knowledge and understanding about formation and types of amyloid. You could ask the candidate to explain, what is amyloid and how it is formed, to name different types of amyloid and how do they arise, to list demonstration methods that could be used to demonstrate amyloid, to give examples of diseases associated with amyloid formation. When addressing this knowledge requirement, candidates should consider misfolding of normal proteins, aggregation of sticky unfolded proteins to form oligomers, fibril formation by aggregation of oligomers, deposition by fibril accumulation in tissues or organs, damage and cellular dysfunction caused by amyloid deposition, key form factors, protein structure, cellular environment, genetic or acquired factors, different types of amyloidosis like AL, light chain from abnormal immunoglobulin. Light chains, AA, from serum amyloid A protein, ATTR, from transthyretin protein, and some rare types like A-beta in Alzheimer's, locations that are affected like heart, kidneys, nerves, liver, spleen, skin, or digestive organs. The third knowledge requirement is principles and practice of routine staining methods for the demonstration of extracellular proteins. Candidate needs to have the knowledge and understanding about demonstration methods for extracellular proteins. You could ask the candidate to list staining methods to visualize extracellular proteins, to explain principles and practice of those staining methods, to name diseases that can be detected by those methods, to explain how the positive staining would look like. When addressing this knowledge requirement, candidates should consider the stains highlighted in the indicative repertoire and stains used in their department, the principles of those stains, their methodology, the practical application of those stains, reagents used and why they are used, control material, positive staining, associated diseases and so on. The fourth knowledge requirement is immunocytochemical methods available for the demonstration of amyloid. Candidate needs to have the knowledge and understanding about IHC methods for amyloid. You could ask the candidate to list the IHC demonstration methods used to demonstrate amyloid, to list specific antibodies used to detect specific amyloid types, to explain the importance of knowing what type of amyloid patient has for the diagnostic and prognostic reasons. When addressing this knowledge requirement, candidates should consider IHC, if and immunogold labeling methods, anti-AA, anti-AL, anti-transthyretin, anti-beta amyloid, anti-kappa, anti-lambda, treatment, prognosis, monitoring, genetic counseling, avoiding misdiagnosis. The fifth knowledge requirement is use of potassium permanganate pretreatment prior to Congo red staining to differentiate between AL and AA amyloid. Candidate needs to have the knowledge and understanding about the role of potassium permanganate in amyloid differentiation. You could ask the candidate to explain, what is potassium permanganate pretreatment? Why is potassium permanganate pretreatment used prior Congo red staining? To explain, how this pretreatment differentiate between AL and AA amyloid, and why it is important to differentiate between AL and AA amyloid. When addressing this knowledge requirement, candidates should consider oxidation of AA amyloid, alteration of amyloid structure, potassium permanganate sensitivity, loss of dye affinity, loss of green birefringence, AA amyloid sensitivity, for AL the amyloid resistance to oxidation, retention of amyloid structure, potassium permanganate resistance, retention of dye affinity and retention of apple-green birefringence. The sixth knowledge requirement is polarized light examination of Congo red stained preparations. Candidate needs to have the knowledge and understanding about the use of polarized light for Congo red staining examination. You could ask the candidate to explain, what is polarized light examination, why it is used for the assessment of Congo red slide, how the Congo red staining looks under the polarized light. When addressing this knowledge requirement, candidates should consider section thickness, beta-pleated sheets, linear structure of the dye, parallel alignment to the amyloid fibril, highly ordered structure that produces apple-green birefringence under polarized light, the way the polarized light interacts with Congo red dye. The seventh knowledge requirement is quality control materials and procedures used in extracellular protein demonstration. Candidate needs to have the knowledge and understanding about procedures used during extracellular protein demonstration, and controls used. You could ask the candidate to name demonstration methods for extracellular protein, to list possible control material used for demonstration of extracellular protein, to explain how to QC those demonstration methods, to explain how the positive staining would look like, to explain the process of control material verification. When addressing this knowledge requirement, candidates should consider collagen and stains like Van Gieson, Son trichrome or Gomery trichrome, elastic fibers and stains like EVG or Orcian, amyloid and Congo red stain, basement membranes and PAS stain, reticular fibers, and Gordon and sweet reticulin stain, fibrin and MSB stain, possible control material, verification and validation, documentation and so on. The eighth knowledge requirement is review cases and material microscopically for internal quality control and external quality assessment. Candidate needs to have the knowledge and understanding about microscopic examination of stained slides for IQC and EQA. You could ask the candidate to explain how to assess quality of relevant demonstration methods, to explain the need for controls, how would assessment be done by EQA assessor, to list quality criteria used by EQA schemes, how to record the process. When addressing this knowledge requirement, candidates should consider color balance and consistency, specificity of staining, uniformity of staining, presence of backstaining, contamination or deposits, presence of nonspecific staining, EQA assessment criteria, control material used, documentation. The ninth knowledge requirement is key clinical conditions where these demonstration methods may be of diagnostic value. Candidate needs to have the knowledge and understanding about diseases that could be diagnosed by using demonstration methods for extracellular proteins and connective tissue. You could ask the candidate to name the clinical conditions that can be detected by using those demonstration methods, to explain the diagnostic value of those demonstration methods. When addressing this knowledge requirement, candidates should consider amyloidosis, renal pathology like nephropathy, cirrhosis, fibrosis, vascular health, solar elastosis, Alzheimer's disease, and other diseases, the value demonstration methods. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is follow demonstration method protocols accurately. Candidates should be able to follow accurately demonstration methods. Does the candidate perform relevant demonstration methods in your lab accurately? Do they follow local SOPs? Do they use manual or automated method? Do they know if the demonstration method was followed accurately? When addressing this competence requirement, candidate could consider SOPs, method used, quality control, use of control material, training, competency, importance of following protocols, method reliability, consistency, reproducibility. The second competence requirement is select and use the correct staining method to demonstrate amyloid and fibrin. Candidates should be able to correctly select and perform staining for amyloid and fibrin. Does the candidate select and use correct staining methods to demonstrate fibrin and amyloid in your lab? Do they follow local protocols and SOPs? If not performed in-house, are they aware of stains used to demonstrate amyloid and fibrin? Do they perform the stains manually or use automated stainers? When addressing this competence requirement, candidate could consider the stains highlighted in the indicative repertoire and stains used in their department, methodology, and SOPs available, whether the stain is automated or manual or both. The third competence requirement is select and use the appropriate control materials. Candidate should be able to select and use correct control material for demonstration methods. Does the candidate uses correct control material for relevant demonstration method? Do they maintain correct audit trail for control material used? Do they produce appropriate control material for each demonstration method? When addressing this competence requirement, candidate could consider tissue types, verification, validation process, record keeping, traceability, audit trail, importance of selecting correct control material, consequences of not using correct controls. The fourth competence requirement is use appropriate microscopy techniques to visualize methods. Candidate should be able to view stained slides microscopically. Does the candidate correctly view stained slides via the microscope? Do they use correct microscope to visualize stained slides? Do they set up and use microscope correctly? When addressing this competence requirement, candidate could consider light microscopy, polarized light, magnification, Kohler's illumination, digital image assessment. The fifth competence requirement is identify stained extracellular protein. Candidate should be able to identify extracellular proteins on a stained slide. Can the candidate identify extracellular proteins on a stained slide correctly? Do they use correct microscopic technique to identify them? Can they identify the demonstration method used to identify extracellular proteins? When addressing this competence requirement, candidate could consider microscopic examination of stained slides, demonstration method used and the target protein and how it would look like on a stained section, their training and competence. The sixth competence requirement is assess stained sections for quality, maintaining appropriate audit trail records. Candidate should be able to assess quality of stained sections. Does the candidate assess stained section for quality correctly? Do they take correct steps during the assessment? Do they focus on correct features in quality of staining? Do they maintain appropriate audit trail? When addressing this competence requirement, candidate could consider color consistency, uniformity, specificity, presence of background, consistency of staining, presence of non-specific staining, staining intensity, EQA assessment criteria, relevant documentation, control material. The seventh competence requirement is resolve any problems associated with the staining method, including root cause analysis, as appropriate. Candidate should be able to troubleshoot staining. Does the candidate resolve problems with staining correctly? Can they identify and solve the common problems? Do they record problems and solutions accurately? When addressing this competence requirement, candidate could consider investigation, problem identification, corrective actions to fix the issue, preventive actions to minimize problems from reoccurring, possible problems like poor staining intensity, poor specificity of staining, artifacts like uneven staining, hazy slides, presence of deposits or precipitate on the slide, reagent contamination, and so on. The eighth competence requirement is for you to dispose of waste reagents safely. Candidates should be able to safely dispose waste reagents. Does the candidate dispose staining reagents safely? Do they follow local procedures and avoid risks associated with staining reagents? Do they segregate waste as per regulations? Addressing this competence requirement, candidate could consider licensed contractors used by your lab, waste segregation, safety data sheet of reagents that often state disposal ways, risk assessments, local policies, and regulations that are followed, health and safety risks associated with reagents like flammability, corrosivity, environmental toxicity. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role in context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. You could ask the candidate to complete tables you created, based on knowledge requirements. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements, and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific and relevant to the candidate's in-house practice. It should also demonstrate candidate's specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.